daily press conferences that we have begun since yesterday to put forward the 15 pledges which Prime Minister Kenny Anthony read on the market steps last week, Thursday. These are the pledges which will largely influence our next term in government when we are returned with a huge majority on June the 7th, which coincidentally will be the 100th birthday of our founder, Sir George Charles. It wasn't planned that way, it was just coincidence. So thank you very much for being here. Today, the pledges we are going to be dealing with, we dealt with 3 yesterday, we're dealing with 3 more today. The first one we'll be dealing with is we will put more money in the pockets of taxpayers by increasing the personal income tax allowance from $18,000 to $30,000. The second one is we'll bring more relief to our tax relief to our pensioners. We will exempt from tax an additional $4,000 for the pensioners. And our third one today, which is our 6th for the week, we will implement universal health care so that every St. Lucian, regardless of financial ability, will be able to get proper and affordable health care. Of course, with me are our Commerce Minister and Member of Parliament for Grosley, Honorable Emma Hippolyte. Next to her is our endorsed candidate for the Castries South East constituency, and the next Member of Parliament for that constituency, Joachim Henry. And of course, our Health Minister and Member for Parliament for Babonneau, Honorable Alvina Reynolds. We begin our pledges today with the Honorable Emma Hippolyte, who will present our first pledge.
Are you ready?
Yeah. Don't say anything out of the way there. You know what
I just asked you, are you ready? We will put money in the pocket of taxpayers by increasing the personal income tax allowance from $18,000 to $30,000, by increasing the personal allowance by $12,000. An additional 3,500 persons will no longer pay income tax or be required to file a tax return. Our administration has always sought to provide tax relief to the disadvantaged, the vulnerable, and those needing a financial boost to enable them to get a good start. In our previous administration, we took several steps in that direction, including 1, we exempted or provided reduction for a 3-year period to first-time homeowners from the payment of property tax. 2, we introduced a registered home ownership savings plan, which made it easier for people to purchase and own their first home by providing an income tax deduction of $6,000. 3, we abolished all taxes on gratuities and tips that were paid to hotel workers. 4, we abolished the entertainment tax that people had to pay to the Inland Revenue tax collectors every time they had a dance or show or some other form of public entertainment. 5, we increased the tax deductions on savings in credit unions from $3,600 to $5,000. And 6, we abolish the need for an exit certificate from the Inland Revenue Department every time someone traveled out of St. Lucia. Many people now take these exemptions and reductions for granted and forget that we would not be benefiting from them had it not been for the understanding and empathy of a Labour Party government, which is always looking for ways to ease the tax burden on the poor, the dispossessed, and the vulnerable. Earlier in the life of this administration, we increased the income tax allowance to $18,000. This pledge is another example of our party's caring for poor people by increasing the personal allowance by a whopping 67% from $18,000 to $30,000. We will be relieving an additional 3,500 St. Lucians from the burden of paying income tax. In other words, anyone earning less than $2,500 a month will no longer have to file a tax return or pay income tax. St. Lucia, the St. Lucia Labour Party government, your caring government.
We will bring more tax relief to our pensioners. We will exempt from tax an additional $4,000 of any income to all pensioners who are citizens of St. Lucia and have attained the age of 60 years. When this additional exemption is added to the new tax threshold of $30,000, the annual tax-free amount that pensioners will receive will be $34,000. Then, when you add this to the allowance that pensioners currently enjoy, it will mean that pensioners will pay income tax only if their annual salary exceeds $40,400. Our Labour government believes that our senior citizens, our champions of yesterday, must be treated with dignity and with respect. They must enjoy comfort and security in the twilight years, and as a caring government, we are committed to looking after the needs of our elderly. This is why we continued our successful and popular Home Repair for the Elderly program during this current term of office. Between 1997 and 2006, we have repaired 273 homes owned by our elderly persons. And over the last 4.5 years, we continue to repair the homes of our elderly citizens. However, it is perhaps our nice National Home Health Program that best demonstrates that caring nature of the Labour government. By providing caregiver services to our senior citizens who have no one to assist them, we have ensured that they can enjoy a better quality of life. It is initiatives such as these that makes us truly appreciative of the unique responsibility that has bestowed upon us as parliamentarians and the need to ensure that every St. Lucian, regardless of age, creed, gender, or economic means, can benefit from the services of our government, a caring Labour government.
Good morning. Number 3, We will implement universal health care so that every St. Lucian, regardless of financial ability, will be able to get proper and affordable health care. The work of this Labour government in the health sector has been truly remarkable. However, it is perhaps one of the areas in which we have not done a good job of public relations. We have not done ourselves justice in showcasing the many ways in which we have improved and modernized the delivery of healthcare in this country. Between 1997 and 2006, the Labour Party government eliminated doctors' fees at all health centers. We refurbished 15 health centers. We trained over 75 doctors. We provided screening and free diabetes and anti-hypertension medication under the pilot UHC program. Fifthly, we made it possible for over 2,000 nationals to receive free eye surgery in Cuba. During this term of office, between 2012 and 2016, we have done the following. 1. Completely rehabilitated the Dennery Hospital with security personnel now employed at the hospital. 2. Refurbished the Soufre Hospital. 3. Completely renovated the Tiroche Wellness Center, that's Tiroche Niku. 4. We expanded the hours of operation of the Grosile Polyclinic until 12 midnight and added a dental department. 5th, we refurbished health centers at Babono, Itangs, Castries, and Nico. 6th, we constructed a Laguerre Wellness Center. 7th, we provided scholarships to 162 public officers to undergo specialized training in health services. 8th, we provided free medication for diabetics and persons diagnosed with high blood pressure. 9th, we removed the VAT on medication. And 10th, we provided an amnesty to persons with outstanding arrears at Victoria and St. Jude hospitals. Very soon, we will open and operate the modern, state-of-the-art Owen King EU Hospital, and St. Jude Hospital is also finally nearing completion. However, the initiative that we are most excited about is the implementation of universal health care. This has been our goal for years. We are nearing the date when every St. Lucian, regardless of economic means, will be guaranteed access to a basket of health services. During the next 5 years, we will implement universal health care, UHC, with a professionally managed health fund that is contributed to by diverse sources of revenue. In particular, we will ensure a strategy for the growth of private health insurance that contributes to the health fund. That's end of number 6, coming from a caring St. Lucia Labour Party government. And now I wish to read a statement in response to the question about the opening of St. Jude Hospital. Our government is extremely pleased that St. Jude Hospital is finally nearing completion. There have been many challenges in completing this hospital, and I must admit that this process has taken much longer than we had originally anticipated. Allow me to provide some background on this so that you may better understand. Originally, the United Workers' Party administration had decided to renovate St. Jude Hospital, and it spent EC $45 million on this exercise before it realized that the problems associated with renovation were so significant that it would have been better to demolish the structure and rebuild. Therefore, while some of the 45 million EC was used for the demolition of the old structure, it is clear that both time and money were wasted because of the original decision by the UWP to renovate. When the decision was made to rebuild New St. Jude, no source of financing was identified, and the government was hoping to finance this project from bonds. It was not until Prime Minister Honorable Dr. Kennedy Anthony visited Taiwan in November of 2013 and met with the then Taiwanese President Ma that an external source of funds for the construction of St. Jude Hospital had been identified. In October 2014, the government of St. Lucia signed a loan with the Taiwan Export-Import Bank for the reconstruction of St. Jude Hospital, and the first set of funds from this loan was disbursed to the government of St. Lucia in January 2015. There were also problems with the main contractor, who had been engaged to undertake the construction. He experienced financial difficulties and had to be terminated in 2014, causing a further setback to the project. When the construction of St. Jude is completed, which we anticipate will happen towards the end of this year, that means the moving in, the transitioning will happen towards the end of this year, the residents of the south of the island, and in particular, the people of St. Lucia in general, will be extremely pleased and proud of the end product. We will have a new St. Jude that is equal to Owen King EU Hospital. In fact, the expenditure on St. Jude Hospital, when it is completed, including furniture, fittings, and equipment, will be close to EC $150 million. The expenditure on the Owen King EU Hospital, minus furniture and equipment, was EC $152 million, with an additional €9 million spent on furniture and equipment. So, in effect, when you look at our work in the health sector in its totality, with the Wellness Center, which was a product of the last Labour administration, and the numbers of health centers we have either built or renovated, St. Lucia will have the best healthcare infrastructure of any country in the Eastern Caribbean, and quite possibly the English-speaking Caribbean. All of this because you have a Labour government that is dedicated to looking after the health and well-being of its citizens. I thank you.
Just want to have you any. Have you go. Unmute yourself. Good. Really give trouble this morning already. All right, members, ladies and gentlemen of the press, if you have any questions on the 3 pledges which were made today, you can direct them to the panel. Lovely. Emma.
This one is for the
Emma.
health minister. We listened to your plans and your status report on the health system. But still, the rule on the ground is that there are a lot of improvements to be made. As the health minister, how would you rate the items you have set on a scale of 1 to 5, 1 being the lowest, 5 the highest? How would you rate our health system?
I would give our healthcare system a very high rating, and I will indicate to you the areas that I am rating. 1, I'm looking at infrastructure. I've said it time and time again that the focus has been primary healthcare, to have prevention first, to make sure our people are well. And we have focused a lot of our attention and pushed a lot of our resources towards rehabilitating or renovating our primary healthcare centers, that is our wellness centers. Secondly, we have focused a lot on training of our healthcare professionals. As we look around the country, maybe 10, 15 years ago, you did not see many of the specialized areas being within the healthcare system. We are focused a lot now on podiatry, taking care of foot care, oncologists. We're looking at now psychiatry, social work, all in the healthcare system. You've seen numbers of nurses being trained through the Labour Party administration in Cuba, as well as Mexico. You see doctors being trained, coming back in a number of areas, and that is always with the intention of focusing on caring for our people. We have noticed a depletion in the number of midwives because they are retiring. And what have we done? Under the 10th EDF, every year we try to train at least 15 midwives to ensure that over a 4-year period, we'll have 60 midwives within the system. So all of it, it's not always the rating of where it's 1 to 5. It's what we have done. I want to dissect it. It's what we have done. For the first time, you've seen the Bureau of Health, or we call it now health promotion. That is the big concept now internationally. And St. Lucia has embraced that. Health promotion experts, they are now doing master's degree in health promotion. And since the time of the World Bank project in HIV and AIDS, you see people going out into the communities with the nurses. They're going out and speak the language of the people to promote health and wellness. For the first time, you see a number of health fairs and walks taking over St. Lucia by storm. For the first time ever, you saw the cabinet of ministers walking in the tracksuit and taking a health pledge. And you look at them and you see they try as best as they can to remain healthy and have a health outlook. Many of our ministers and parliamentarians have done health fairs. I must commend Minister Emma Hippolyte. And yes, there is room for improvement. And this is why we are equipping our new hospital with state-of-the-art. For years, that is one of the areas I think we need to improve on. St. Lucians have to travel overseas for care with cancer and other areas, and it's costing them a lot. And the stress of having to travel is a little bit of a burden. So now, with the EU hospital and St. Jude, with state-of-the-art equipment, St. Lucians can access the services right here. We're looking at September for the opening of the end of September, the EU Owen King Hospital. We're looking at moving into the new St. Jude the end of December. So within this year of 2016, we're looking at St. Lucians accessing those kinds of services that they would go overseas for right here. We're looking at, again, UHC. We started. People who are mentally ill, they do not pay for medication. Yes, The mental health teams were disbanded, and we are finding the resources to pull the teams back in and have them go into the community. Right now, HIV and AIDS being taken care of at the community level. Mental illness taken care of at the community level. Instead of taking everybody to Castries or Vieux, we are decentralizing the services. So when I look at that, I give it a very high rating. I'll go beyond 5. But like I said, there are areas that we need to improve, and this government has its finger on the button, and that is to do what is absolutely necessary. Implement the UHC and open the brand new hospitals, but the focus is always prevention.
For the critics who will say that in the manifesto, that was one of the issues.
Pardon?
Universal health care.
Yes,
And again, you have the pledges, you see it again.
yes.
So the people who will say, if not then, when you came on that promise, you came in on that promise, it was not achieved, why not?
Because the economy is turning around. As we indicated during our term in office, it was belt tightening. Which government would implement something that you know you start and you can't finish? We were very honest with the people of St. Lucia. Look at how we negotiated with our public servants because it was tough times. We had to do what we had to do. We did not cut medication from anybody. People continued to get their medication, even if it was tough economic times. We opened the Dennery Hospital. We built brand new health centers. We continue to give medication across the board free of charge. And UHC had started under us. We continue to work at it. It was dead in the waters for 5 years. You cannot implement a UHC with costs that were 5 years ago. You cannot implement a UHC. You needed the research to tell you what is happening presently with your people, what areas you need to focus on first as you roll out UHC in a phased approach. And that is what we did. We went back and looked at all the information. New consultants brought in, look at entirely what is happening presently. What are the areas that St. Lucians are suffering from? We know cancer, we know hypertension and medication, but UHC is not only medication. It's a basket of services starting with health promotion. We will engage health promotion people, personnel, to go out to teach St. Lucians how to manage themselves. That is part of the UHC. That's a brand new thinking. Also, when persons have a condition, how to manage to prevent ending up at hospital. We try not to push all the resources into hospitals. We try to put a lot of it into prevention. Second phase into our community health centers, of course. Diagnosing, early diagnosis, treatment and care. We're also looking at rehabilitation. So we have a plan to continue rolling out a revolution in the health system for St. Lucians.
So in essence, due to the economic situation, universal health care was not feasible at the time, but you are confident that given the improvement in the economy, that you will be able to roll out universal health care this time around.
Yes, and I'm saying it's not the government and people of St. Lucia. Step by step, we will inform St. Lucians as to how it's going to happen. What is their role? When we look at a basket of services, how much it is going to cost? How are we going to finance it? What will be the role of government? What will be the role of insurance companies? All of that you have seen in the Ministry of Health. Everything we've done, we've come to you and tell you we're doing. Another part I'm very proud of is the health information system that started 5 years ago. We've rolled out the health information system technology in our health centers so that when UHC comes on board, wherever the patients may go, the medical team will have access to the health information and be able to take care of them. You fall sick in Beaufort, your records will be there. You fall sick in Soufrière, it will be. It's across and hoping to bring on board the private sector as well. And very soon you will see going to Parliament with the health records bill that is to ensure confidentiality, that people's health records stay within the system and not out on the streets. So there's lots that we are excited about. As the Prime Minister has said, it's going to be the priority. Yes, we had a bit of belt tightening as anything else. We went through Ebola, we went through chikungunya, we went through dengue, Zika, and the works. And we were able to pull through the little bit of resources that we had. We were able to do a lot with very little. But I'm encouraged that the economy is turning around, and so I'm waiting to embrace that revolution in the healthcare
Is there
system.
a time frame that you can give the public?
At this point, I think I would leave within the Ministry of Finance. We have completed the report on the basket of services and the costings with our consultants, submitted to the Ministry of Finance, and then the conversation continues. And like I said, step by step, we will inform the people of St. Lucia where we are going, what time frame, etc. But not only the Ministry of Health is involved in this, but the Ministry of Finance, critical.
Also, lovely, just to add, the minister did read in the pledge that the government would have a private sector partnership in terms of the private health insurance. So that would be some discussions that have to take place as well.
Okay. As soon as the pledges were rolled out, there was response from the opposition camp. One of the first people to comment on the pledges was Dr. Yvonne Freeman, former assembly member, who spoke about the income tax allowance, saying that it was something in the manifesto which was not accomplished. Why now? Your response to that?
Which the increase in income tax?
Yes, the increase in the income tax allowance.
To 30,000 in the manifesto?
Not to 30,000.
Oh, because there has been an increase in income tax threshold in the life of this government. If you look at the past budgets of the Prime Minister, you will see that there have been increases during this administration. It is just that Dr. Raymond can't believe that we could manage the economy so well that we are going to double the threshold. That is the problem. That's his problem, not ours.
Okay, I have a question on. I have a question on the elderly. There is some concern that there is so much of a focus on youth and the youth votes, and I think rightly so. But nonetheless, there are some of our elderly who feel that you don't hear enough about the elderly in this campaign, not just from the SLP camp, but from both camps. That you keep hearing a lot about bringing out the youth vote, the youth, and they don't feel that they're hearing enough about them. Are there other plans, or what is the plan of the party for the elderly that you could probably allay some of those concerns that they have, that maybe they're being left out of this whole grand vision? Well, I note that there's the relief to pension.
But before the minister answers, I want to make it clear. The Labour Party isn't presenting its manifesto, isn't doing the work it is doing for votes. The Labour Party is doing it because it has always been a government committed to caring, for freedom, for justice, and for bread. There is no plan to do things for the youth simply for the youth to vote for St. Lucia, for the Labour Party. We do things for the youth because the youth are an important segment of our society. We do things for the elderly because they have served us well, and we must show gratitude to them. So I just wanted to make that clear, that we do it regardless of whether they vote for us or not. Minister?
Yes, I'm sure you've heard of the home care program. And this is what I'm hearing from our older folks around the country. The way they have been cared for. When I attend funerals of our elderly, and I see home caregivers attending funerals and giving testimonies about the relationship, when they're being called, their names are being called on obituaries. When I attend a wheelchair ceremony, a presentation ceremony, and I see a home caregiver in uniform coming with her client, we tried, and I think the first time the government did it, there was a cry for more. What did the government of St. Lucia do? We increased the numbers. And there is a pledge to increase again because we have not touched all of our elderly. There is a cry from families to bring that help to them. There's also the home renovation that you have seen happening from the government of St. Lucia. As our elderly, their homes begin to fall apart, we go around and my dear colleague can speak to that. Renovations of homes. And there are things that our elderly, as the request comes from their families, from themselves, through the churches, will respond accordingly. There has been a significant way of helping our elderly. Even now, when we see the issue of elderly abuse, I'm sure you have seen on the show, say, the Human Services Department putting out a big exhibition to bring to the fore the issue of elderly abuse, to ensure when our elderly go missing, how we have that community coming together to see that they're there, bringing them out into homes for themselves that they can meet. And this is one of the plans for even in Babonneau, that we have a home for them in Babonneau. They can come and relax and cook and knit and listen to music and do their, the quadrille and the good old things. So I think it's something that every constituency should look into, a home, a place, a space where our elderly can come. So individually, parliamentarians may have the plans for the elderly, but I know for sure with our government, we continue to look for caring for them. This has been the number one cry from our elderly. The food, when they need the hampers. Secondly, the home repair. Thirdly, someone to talk to them because their families abandon them sometimes. Somebody to calm them. Somebody to just listen to their story. And I see that with what the government has been doing, I see young people getting involved in building homes. I see our students learning from that and going to visit our elderly. So they are not forgotten. It's just that we are so used to doing for our elderly, we'll just roll this out completely. It doesn't have to be an election for the elderly. It is that we are used to taking care of them. We will just continue improving on the services for them.
Just to add to what the minister said, between 1997 and 2006, we did one home every 2 weeks for the entire 10-year period. We did 273 homes in that 10-year period. That works out one home every fortnight for the elderly. And we have continued that program. Joachim, I'm sure you can speak to that aspect of it.
Certainly. The idea of the adult daycare center under the Basic Need Trust Fund is a very unique project, and it's one that I'm hoping that we will advocate for more of these kind of projects. And I think I've always asked the media to visit such projects, go to Leclerc and look at the adult daycare center where the senior people are being cared for persons who are not able to stay home with their family, with their grandmother. They're able to place them at a center where they are socializing, where they're planting flowers. These projects were birthed within the philosophy of the St. Lucia Labour Party. And this is a very significant project. Construction of homes over the past years, I cannot count, but we've invested millions of dollars in caring for our senior citizens and persons who are vulnerable. We've reported on, I think, on 1 year where we did pretty close to around 300 homes. And when we speak of housing assistance, most times we're not just speaking of just the four walls, the roof, and the floors. But in 1 year, we produced more than 276 latrines for a place where persons could not have, the flushing system, that's in Belmont, and provide them with water tanks. So ensuring that persons are living comfortable as much as possible has been the objective of the Labour government. So in more than one way, we have provided support to our senior people and to vulnerable homes. The track record is there. And when I go around the constituency, even at this time, people remind me, UWPs remind me in Sarah, even while they're in the yellow shirt, that I came to the SSDF and received housing assistance. And I think that's amazing that the Labour Party has a track record of just reaching across to St. Lucians, because we recognize that citizens have rights to basic services. This is not a voting campaign matter.
My final question, and I'm sure that people will kill me after this question. Minister, ambulance services in various communities. For instance, Shwazella is one. You have an emergency, you call, you have to wait for Soufre or Vieux. I know previously there was an ambulance station at La Falle, which would. Can you give us an update, the vision, the plan as it relates to ambulance services for communities?
Okay. I can speak only to as it pertains to the health sector, because ambulances are based within the fire stations. However, some kind St. Lucians have seen it necessary to send ambulances to communities, ancillary, canneries, etc. The brand new health center that we are commencing in ancillary will have an ambulance. The ambulance's situation at the health centers is that you need to have staffing for your ambulance. A driver plus somebody who's well trained and certified in emergency care. How many times do you have that call coming in? Do you have somebody who may be on staff and maybe you have a call once a day or twice a day? So with the resources dwindling as they are, we're trying to see how we can manage having an ambulance service at the same time, not having persons employed or who may not be working full time. So the plan continues to be rolled out, working with the Ministry of Home Affairs and National Security, see how we can collaborate those services. Some time ago, a friendly government, provided us with some of those little ambulances to be able to go up in the hills and so on to retrieve people. But again, the situation was staff. How do we recruit? Do we recruit staff per health center to wait for ambulance services so that they could go in to bring persons to? So it means that it has to be revisited. And of course the Minister Lacobini has said that we do not have enough of our staff even at the fire station. We do not have enough persons who are well trained, and they are fire officers. Okay? So if we do not have here, we are unable to deploy them at the health centers. So yes, it is something where we have to look into human resource capacity for those communities that are far away from hospitals, so that when something happens in the Choiseul belt, and I've started the conversation with Minister Lawrence Theophilus, he has raised the issue about the ambulance and the driver. The situation is we must find the resources, or find someone within, either private or within the fire station, who can work maybe the part-time service. Something has to work for the people of Choiseul. Something has to work within the ancillary canneries belt because of the distance that they are away from. I do agree, and like I said, we are looking at it in a wholesome way, not the Ministry of Health alone, but with the Ministry of Home Affairs and National Security. They are the ones doing the training, they are the ones manning the ambulances, so we'll work with them to see what can be the best way forward for these situations in Choiseul and Canneries Ancillary.
People in Choiseul will be well pleased with your question. Why you want to go off the record now? So that's it? Well, thank you very much, ladies and gentlemen of the press, and we will meet again on Friday morning, same time, same place, where we will unveil the next 3 sets of pledges with a different set of presenters. So thank you very much for being here. Let me thank the Commerce Minister and the MP for Grizzly, Honorable Emma Hippolyte, the endorsed candidate for the St. Lucia Labour Party for the Castries South East constituency, Joachim Henry, and the Health Minister and Babonneau MP, Honorable Alvin Reynolds. Thank you very much for enlightening us.
Thank you.
Thank you.
Have a happy Corpus Christi, everybody.
What do you want to ask me?
Sorry, I have to run.
Oh, yeah.
Yeah.
Of what?
Up.
I am sweating.
Are we ready?
Yep.
Oh,
Are we ready?
I am ready.
I'm ready.
Both the photographers are ready.
Thank you.
One more.
Thank you.
I'm sweating like a piggy.
Mary, somehow I think folks block you, you know.